Hello everyone, my name is Olivia Wickham and I will be doing my PowerPoint presentation on the psychological, physical, biological, and social perspective of anorexia nervosa. Anorexia nervosa is defined as a complex eating disorder that is characterized by a self-induced disturbance in eating patterns that leads to extreme weight loss. There are two different subtypes of anorexia according to the DSM-5. One subtype is referred to as the restricting type, in which individuals will limit their food intake. The second subtype is called the binge-purge subtype, in which a person partakes in binge eating followed by subsequent purging using different methods such as self-induced vomiting or laxatives. Anorexia is found to be the most common in adolescent females aged 15 to 19 years old and is the most deadly psychiatric disorder, with the risk of premature death among patients suffering from AN being shown to be threefold greater than that of the rest of the population. Treatment for this disorder is possible, but routinely has a high level of difficulty and success. What is oftentimes seen in patients with anorexia is that they are in complete denial that they have any issues that need to be addressed, with no inclination to try and change any of their disordered behaviors. Because of this, and the life-threatening nature of this disorder, hospitalizing the patient for treatment is unfortunately the rule and not always presented as an option. Anorexia treatment involves several different strategies to help the patient not only gain weight in a healthy way, but also address any issues that may be contributing to their disorder. Due to the body's fragility that is so often seen in AN patients with very low weights, refeeding strategies need to be done very slowly, as there are many serious and potentially deadly complications that can occur during the process. Nutritional supplements will also be provided to aid in meeting necessary dietary goals. Different medications are often prescribed as well, like SSRIs to help ease any symptoms of depression or anxiety, which is a common experience for patients with AN. The treatment options are a perfect segue to our psychological perspective. On a psychological level, anorexia heavily impacts a person with the diagnosis. A person suffering from anorexia will often have a distorted view of their body, which aids in the belief that they are fat, leaving them with extreme fear of putting on weight. The person experiencing this distorted view that appears to them as deformed and overweight will often be of normal weight or even underweight. Anorexia can also psychologically impact a patient due to the high level of comorbidity found between AN and different mood disorders like depression, anxiety, and OCD. The comorbidity can make the clinical management of each diagnosis much more difficult. An example of this increased difficulty can be seen when trying to equip different types of therapy strategies for OCD treatment. Unfortunately, in cases that involve comorbidity and anorexia and OCD, due to the negative cognitive toll that starvation takes on very low-weight patients for suffering with anorexia nervosa, patients report difficulty in not only participating in but also gaining usefulness from therapies used for OCD treatment. Keeping in mind these clinical complications faced by those aiding in treatment, it is clear that it is important for professionals to explore the relationship between OCD and anorexia, along with the other mentioned mood disorders, further, in efforts to better understand how to treat these types of cases with a higher rate of success. A Swedish study conducted by Martin Cederloff in 2015 took a closer look into the association between OCD and anorexia to examine if there were any patterns of comorbidity, the risks on a longitudinal level, and familial risks and genetic factors shared between OCD and AN at the population level. Longitudinal analysis conducted by Cederloff showed that individuals who were first diagnosed with OCD had an increased risk to later being diagnosed with anorexia, whereas individuals who were first diagnosed with anorexia had an even greater risk for later diagnosis of OCD. These findings support the theory that genetic components play a heavy hand in these diagnoses co-occurring. Further exploration of an anorexic patient's psyche took place during a study conducted by Sarah Williams and Marie Reed in 2012, where they observed 14 people who used pro-recovery websites and blogs in aid for their recovery. Participants in the study had described their disorder as a tool used not only to avoid the possibility of feeling negative emotions, but also for changing their identity and obtaining a sense of control. A common theme in reporting from participants in this study was the experience of an anorexic voice in their head. This voice was described by participants as containing both evil and friendly qualities, and it felt like to them as an external entity that criticized individuals and sometimes dominated their sense of self. The participants also revealed that this voice would only get worse as their disorder progressed. While much of anorexia is psychological, what's visibly noticeable about people with anorexia from an outsider's perspective is the physical toll this disorder takes on a person. Physically, AN can be detrimental to a person and their body's typical functioning and appearance. Some of the complications experienced by an AN patient can have permanent adverse effects even after there is a successful program of nutritional rehabilitation and weight restoration. Various physical warning signs that may be observed are as follows: extreme weight loss, malnourished appearance, exhaustion or overtiredness, dizziness apart from or experienced alongside of fainting, seizures, brittle hair that appears thin and falls out, absence of menstrual period, also known as amenorrhea, the growth of a thin layer of hair on the body, usually on the face, back, and arms, known as lanugo. The first physical effect that is typically apparent in a person who has anorexia is rapid and severe weight loss. This weight loss is usually experienced alongside feelings of severe pain and discomfort in all tissues, including the skin, organs, muscles, and bones, as their system deteriorates from the inside out. Other physical symptoms of anorexia can occur at any point throughout the duration of the disorder, like loss of pigmentation in the skin, which typically results in a bluish, gray sort of hued appearance, or rapid signs of aging due to the skin's loss of elasticity, which usually makes an appearance of paper-thin and wrinkled skin. The drastic weight loss experienced by patients with anorexia will cause serious internal complications that affect normal functioning. This includes the size of the patient's heart decreasing, which leaves them vulnerable to potentially fatal rhythm irregularities, as well as the patient's blood pressure falling, with brain atrophy or shrinkage, which can be observed in the gray matter of the brain. There also is decreased hormone secretions, and this can contribute to the loss of menstrual cycles. Unfortunately, with anorexia, medical complications account for more than half of the deaths in all patients with the disorder. After severe emaciation has occurred, typically after months or even years of practicing disordered eating habits consistent with an anorexia diagnosis, is when lanugo and amenorrhea will present themselves. Lanugo, as mentioned before, is a fine body hair that will begin to grow on a person suffering from anorexia, which acts as the body's equipped strategy used in efforts to protect itself against heat loss that is associated with the extreme thinness seen in anorexic patients. Amenorrhea is defined by at least 3 menstrual periods in a row, and this event should not be taken lightly, as it acts as a warning sign that your body is not functioning correctly. It is estimated that of patients with anorexia nervosa, approximately 50 to 75% will experience amenorrhea during the course of dieting and weight loss. Next, to dissect this disorder on a biological level, studies conducted around the causes of the development of anorexia nervosa have produced results suggesting that there is a large relationship between the biological makeup of a person and anorexia development. There's heavy debate about whether this is a disorder driven more by environmental and social factors or more by biological factors. However, research done in this area suggests that eating disorders do in fact have a fairly strong genetic link, and it has long been reported that eating disorders often run in families. However, the explanation for this observation has yet to be identified. The last decade, due to the advancements we've seen technologically, genetic epidemiology of eating disorders has had much more attention in research. However, the bulk of research, clinical attention, and funding is still funneled into studies regarding environmental risk factors. Particular focus is placed on socio-cultural influences like unrealistically thin images of women and girls depicted in media images, or heavy societal insinuation that beauty is synonymous with thin, and vice versa. What is rather curious, though, about societal influences on eating disorders is that although nearly all women on a global scale are exposed to these examples of sociocultural influences, only a very small proportion of those women will actually go on to be diagnosed with an eating disorder. Reports documented estimate that only about 1% of female adolescents have anorexia, and approximately 0.5 to 3.7% of women will suffer from anorexia at some point in their lifetime. Various studies conducted surrounding genetic vulnerability have suggested that there is a notable role that biological factors play in the development of eating disorders. Family studies concerning anorexia and bulimia nervosa have frequently found an increased chance of lifetime occurrence of eating disorders in family members of eating disorder subjects than among family members of control groups. Furthermore, there have been several studies concerning eating disorder and twins where results suggest that the development of eating disorders like anorexia and bulimia are greatly impacted by addictive genetic factors. It is likely that there will not be one single gene that can be to blame for the cause of anorexia or other eating disorders, but rather a collection of genes that may predispose a person to its development. Keeping that in mind, it is necessary not to ignore the effect that environmental factors have been observed to have on contributing to the development of an eating disorder. However, it is also necessary to keep in mind that further exploration and funding put into genetic research could be a fruitful avenue that provides us with better understanding of not only who may be more vulnerable to reported environmental triggers, but also hopefully restructure treatment plans that have a higher frequency of success and effectiveness. Although each individual eating disorder case is unique, genetic vulnerability has been reported to have notable effects that can neither be rejected nor disregarded. Moving on, and looking at anorexia nervosa from a social lens, there is a noticeable hand that social factors play in not only the disorder's development, but its continuation. Peer approval for weight-restricting strategies can also play a significant role in perpetuating a distorted body image, seemingly acting as an unintended motivator to drive an AN patient's restrictive behaviors. For example, a person may notice that their friend has shed a few pounds and say to them, "Wow, you've lost so much weight. You look great." This comment could possibly further restriction efforts for a person suffering from an eating disorder, as they see their weight loss methods are working through peer approval. This can be especially dangerous if the person encouraging the behavior is a family member. What we also see as a social factor that plays into eating disorder development is the celebration of stick-thin women in media, on the runway, on television, as well as the romanticization of disordered eating on social media and in film. We have long since been pushed this unrealistic standard of beauty for women and girls to strive to attain in the media, in fashion, and on TV. But something has emerged that may be even more harmful: online pro-anorexia or pro-ANA communities. There have been online health communities that help facilitate communication among people with health problems since the birth of the internet. But what do you get when a community is promoting perpetuation of disorder and discouraging recovery? Pro-anorexia communities. These communities have existed on Twitter, Tumblr, YouTube, and tons of other platforms for several years, and their efforts have been centered around painting anorexia as a lifestyle rather than a disorder. These communities engage in creating and sharing content that encourages an unrealistic ideal of thinness and inspires people to lose weight, as well as offering tips on how to become and remain extremely thin. Closely related to the pro-ANA community, but vastly different from said community, are the anti-ANA and pro-recovery communities, who can be found posting on the same platforms. Research conducted by Dawn Bree Branley and Judith Covey aimed to characterize the different types of communications that are posted on the Twitter and Tumblr media platforms, and they observed that pro-ANA posts were made more frequently on the Twitter platform as opposed to Tumblr, whereas conversely, anti-ANA and pro-recovery posts were made more frequently on the platform Tumblr. Fortunately, what they found was that generally between both platforms, extreme pro-ANA posts comprised the minority of postings when compared to anti-ANA and pro-recovery postings. The concerns surrounding a community driven solely to encourage one another to engage in disordered eating behaviors are massive. For one, they are essentially normalizing the reckless behaviors associated with eating disorders by making the community member feel that it is not only acceptable and justifiable, but also desirable. These communities give rise to such concern due to the connectivity that social media provides and its daily use by young users who are the age group most vulnerable to and affected by eating disorders. Further socially centered research about anorexia has shown that the eating disorder diagnosis has a negative effect on a patient's social life and that social difficulties may even help facilitate in the development of anorexia nervosa. A study conducted by Valentina Cardi studied 90 participants who reported a lifetime of struggling with anorexia nervosa. The sample consisted of 88 women and 2 men, where each participant was to complete an online survey. This would be used in order to assess each participant's memories of involved involuntary submissiveness within their family, fear of negative judgment or rejection from peers, level of personal perceived social competence, feelings of belonging on a social level, symptoms related to their eating disorder development, and adjustments made at work or socially. This survey produced results that documented that of the 90 total participants, 81 participants had disclosed that their eating disorder had had a negative impact on their social life, leaving just 8 of the participants reporting that their eating disorder did not cause change in their social relationships. Participants in the study also reported that they lacked social skills and that they held the belief that they are a burden to others that are close to them, as well as the rest of society at large. Findings of the study add weight to the hypothesis that suggests that social difficulties are fuel in the maintenance of an eating disorder. Alright, those are my references, and good luck to everybody else on their presentations, and thank you for listening!